Today, every day, small cap investors visit Agoracom knowing this is the day to discover the world's next great company, to have their dreams come true. That's why I take to the open road, to find them, to tell their stories, to engage them, to bring them to life, because they want to connect with you from your office, your phone, your home, anywhere. Agoracom, find your dream. Welcome to Beyond the Press Release, a production of Agoracom, in which we speak to small cap CEOs right after they put out important news. With us, we're happy to have him back, Aras Azadian. He's CEO of Avicanna Inc., trades on the TSX Big Board under the stock symbol AVCN. And for our friends in the US, again on the Big Board OTC, that's the OTCQX AVCNF. For those of you new to the story, it's going to be a lot of you because we've just started with the company over the last month. Avicanna is a vertically integrated biopharma company that's delivering and developing, cannabinoid-based products, and they're doing it for the global marketplace. I know that sounds like a lot of lip service, but they've got exposure to all four verticals. On the consumer side, they've got the only known CBD cosmetics brand that's backed by actual clinical trials. On the medical cannabis side, you're going to hear that they've launched nationwide in Canada with the online arm of Shoppers Drug Mart. On their pharma side, 3 of their products are already as far as phase 2, and their cultivation, which you're going to hear more about today, 500,000 square feet, USDA certified organic cannabis cultivation in Colombia. Right now, one of their claims to fame is that they have the first ever export of feminized hemp seeds from Colombia to the U.S. That was a big sale. So more is happening. Here to talk about is Aras. Welcome back, Aras.
Thanks for having me back.
Let's talk. There's 2 press releases that we're going to be talking today. Let's talk about the first one, the numbers. I think that's important. Avicanna reported second quarter, its Q2 numbers recently. Here's what I love. You actually reported sequential. Very few people do that. Q1 to Q2, 172% sequential. Year over year, 4,200%. So before we get into the numbers and dive a little bit into them, how are you guys feeling, and how does this validate Avicanna, where you've been telling your shareholders that you're going to be delivering?
Well, we feel very good, obviously, to be progressing. I mean, we always have been a biotech company, and we've been focused on the pharmaceutical applications. But when we saw where the industry is trending and sort of the access to capital and the cost for capital is going up, we realized that we need to pivot to some extent to make the company cash flow positive and less reliant on fundraising. So we started that process Q4 19, and it was really a threefold process. It was, let's lower costs, and we went in Q4 from roughly $8 million in expenses to Q1, where cost was about $4 million, into Q2, where cost was about 2.9. So you're seeing a progressive reduction of costs because, one, we're done build out, we're done a lot of our R&D. We are now in a commercial state, but also we realize that we need to become a lot more self-sufficient. And then in parallel, what we've done is we started commercializing our products that we spent years developing.
Got to do
it. And again, I explained that last time. The product life cycle for Avicanna is a lot different than your typical weed company. We don't grow flower, put it in a bag and sell it. That's quite easy. We take flower, we extract it, we isolate it in some cases. We then put them into formulations that we spend years developing, that we've done preclinical and clinical development on. We then do the branding and the marketing and then put that into a retail or a pharmacy chain. That takes a very long time. And we are now at the stage where we have launched these products in a few markets, and we're launching much more as we progress. So what you're starting to see on these revenues increasing and the cost decreasing and decreasing is because we're done the development, we're now in revenue, we're now in commercial state.
Yeah.
And every quarter you're going to see more and more business models get activated in more and more markets, because our products are competitive, our products are proprietary, our products are unique. It's not flour in a bag. So the more and more markets we get into, you're going to continue to see that revenue spike up. And because we're quite lean from an operations point of view, it doesn't take a lot for us to be profitable. You know, our burn is quite low, and we've spent a lot of resources and time and energy to be where we are today.
And more than just lip service for everyone home. So you did just over $700,000 in revenue for Q2, but that really does include the fact that, and you know, this is putting your money where your mouth is. You successfully launched the your first medical cannabis products nationwide through Shoppers Drug Mart online. So let's talk about that. Is that a full rollout, or is that staggering products? And as a result, you're just going to be getting stronger and stronger as time moves on.
It's staggered, but so in the numbers in Q2 didn't include that.
Yeah, of course.
So the numbers in Q2 didn't include that. We launched about a month ago in Shoppers Drug Mart. We launched with our 2 initial SKUs that were oil drops, highly bioavailable products that taste good, they act better, they perform better. And we've had a very successful launch with that, with Shoppers Drug Mart. That's the feedback and that's the analytics that we're getting. Next week, we launched 2 additional SKUs of products, and we're shortly after that, we'll be launching the topical products. Then shortly after that will be capsules. So there's a pipeline of products that actually comes after that, which is transdermal patches and tablets. And with this is very different than a consumer or recreational product. These are medical. So we're converting patients, we're converting physicians. We're educating them, training physicians to actually prescribe our products. And the fact that we've had a very good early start is a very good sign as to the potential of where this is going to go.
Yeah, you guys have gone out of your way to give doctors as much, evidence-based product to make it comfortable for them to prescribe, as opposed to what was going on in 1.0, where doctors were terrified of that. You kind of hinted at it, Aras. But so far on the first rollout with the micro drops, are you happy? And you don't have to give us specifics. I mean, we'd love it if you could, but I don't think you can. But has the rollout with the micro drops so far been as expected or better than expected?
It's been better than expected. I can say that by us and by shoppers. Both teams are pretty excited about the early results, especially because this is a sticky, long process. The sticky part is good because once you get a patient and they like the product, they're going to continue to use that product and they're going to refer it. And once you get a physician and they start prescribing your product, they're likely going to prescribe it to other patients. So the fact that in the first few weeks we had that type of response was incredible for us. I mean, but that's, I think, 3-4 years of product development and 3-4 years of reputational development. We're very well respected in Canada. We are certainly thought leaders on the research, clinical, R&D side, and we're seeing the fruits of that labor come in. Right, we're seeing physicians, hospitals, clinicians, clinics say, you know what, I just want to recommend Avicanna's products because you guys are medical. You're only medical, and I feel comfortable. And I've been saying this for a very long time. Right now, less than 5% of physicians are prescribing cannabis. And it's because the physicians are not very happy with the Canadian licensed producers. Maybe some of them lost money in their investments, but
or more importantly, they just don't want to make sure they don't actually get their customer. Look, do no harm, right? That's the number one rule.
That's the number one. So they're not comfortable. Why are only 5% of physicians prescribing? Why is only 1% of Canadians using medical cannabis? As a society, we're quite open to it. So it's because they don't feel comfortable. They don't want to prescribe from the same company that sells joints. So we provide an opportunity to actually have dose-controlled, consistent, stable products that are strictly for medical use. And we provide the education and the training that goes with it. And no one has really done that in Canada. No one has actually taken that position. So we believe we're going to increase that market share. We're gonna target the physicians that are naive, that are not prescribing, patients that are naive, the old lady that would probably benefit from it, but it doesn't feel comfortable to smoke a joint.
Aras, my mom is a classic example. She's older, she's got the aches and pains, she got arthritis in the knees and all that, and I've been waiting for something like this because I had the same concerns you did, right? So it won't be long until I'm visiting that with my mom, my mother-in-law, people who are older, right? And say, hey, we can feel comfortable with this. Let's do it, right? So there's no doubt about it. And just to be clear, because you kind of said it earlier, I want for everyone at home, Q2, you're coming out with your sublingual sprays and the topical products. Sorry, Q3, And
Q3 will be the
Q4 is the
subliminal
capsules. Q4 is a capsule. So people
yeah,
can be
end
able
of
to take it any way
Q3.
they want.
Yeah, sorry. So yeah, end of Q3 will be topicals, beginning of Q4 will be topicals, and then capsules, and then there's the pipeline. There's sublingual tablets, oral tablets, transdermal patches. We're just getting started. You know, we've done all this development work for years. Now it's the commercialization. So that's the other thing, right? I know $700,000 is not a lot of revenue, but it is to a company that has just began commercialization.
Yeah, absolutely. Yeah,
right.
You're right at the beginning of the. This is the ideal time for investors because you're right at the commercialization stage after years of R&D. We talked about in the last interview the Tortoise and the Hare. You know, George Cannabis ran out there as fast as possible, stumbled all over himself trying to get sales and share price up, but they failed. So many big failures, epic failures. Whereas Avicanna was the tortoise, slow, do it right, measure 3 times, cut once, and now you're just at the beginning of that. I'm really excited. But staying with the medical cannabis with with your Row Phyto, right? You're not totally stopping because you're participating. You're participating in a medical cannabis. You call it real world evidence study, a clinical study with the, and I'm going to read it here, the University Health Network.
Yeah.
What's that about? What's the main objective there?
So UHN is the biggest medical institution in Canada. UHN, the University Health Network, consists of, Princess Margaret Cancer Center, Toronto General Hospital, and it's all the major hospitals here, which are down the street for us, right? Like we are in the center of that. We collaborate with all those physicians. So Shoppers Drug Mart and UHN collaborated to put together a real world evidence trial, which means real patients buying real products that are already approved, which includes Avicanna. There's a select group of companies that are participating. And we're going to be measuring 2,000 patients and how it affects specific comorbidities. So we're going to look at pain, anxiety, depression specifically. And we're involved in that trial. We're one of the few companies that are. But in addition to that, we're involved.
Can you tell us how many companies are?
I think it's 4 or 5.
That's big to be part of that small group.
Yeah, they're all multi-billion-dollar sort of Canadian licensed producers. We're not a Canadian licensed producer. We're a biotech company in Canada that is launched in Canada. There's a difference. I don't have a massive Canadian infrastructure of indoor grow ops, etc. But I'm still selling products to the medical community and patients now. In addition to that, we have another 4 or 5 clinical trials that are in a very similar setting. So because our products are now approved, I don't have to go through the typical phase 1, phase 2, phase 3 just to start generating data. We're taking that pharmaceutical pathway, but in parallel, I get to now give physicians and patients access to my products and monitor them in particular therapeutic indications and see how well these products work. So example, let's say there's a physician that is an expert at epilepsy. He can start recommending our products to his epileptic patients, and we can monitor them and we can see which dose, which titration, which delivery work the best. That data,
invaluable,
very strategically valuable, because that data then becomes marketing material to go to the medical community and say, hey, look how well the Row products work for epilepsy in this particular dose or delivery. And in addition to that, it allows us to then get a little bit more specific and increase the probability of success on the pharmaceutical side. And we're doing this while we're selling products. So it's again, most investors unfortunately are not looking under the hood to see the value of these type of things we're doing.
They are now. That's why we're doing this, right? I mean, look, you've got the best of the best. You got 4 to 5 companies have been invited, and you've got the best of the best of the health network of the hospitals that are running this, right?
Well, George, it's a little bit better than that, because the best of the best and the 4 or 5 companies is one study. The other studies that I was referring to range from epilepsy to Parkinson's and IBD and Crohn's. Those are only us. That's Avicanna with the top medical institutions in Canada.
Okay.
So we're alone in those.
Those are just you.
Those are just us. And that's because those institutions do not want to work with recreational companies.
Buddy, for everyone at home, look, what does that say, right? You can infer, you can read between the lines there, right? You can read between the lines when the best hospitals in the city, essentially the best hospitals in the country, are saying, no, we just want to work with Avicanna on these specific initiatives.
Yeah. That's a point of pride for us. Absolutely.
Yeah, you don't have to, if for anyone who's an investor, you don't have to struggle at that point with due diligence and say, essentially the hospitals by inference are doing the due diligence for you. I mean, the tests and trials still have to happen, but they're saying, no, Avicanna is the one we want to work with. If they're saying that, then, you know, that really helps. That really knocks down the any hurdles related to due diligence and worrying about these things.
Yeah. And you have to consider that these are like Sick Kids Hospital, UHN, Toronto General Hospital, Mount Sinai Hospital. These are major global leaders in particular, you know, indications, and they're quite conservative in nature. So it's not like it's a small clinic and they're getting paid, you know, they're getting, for example, commission from selling our products. No, these are people that are saying, look, I believe in the potential of cannabinoids. I like to study it, but I'm only willing to do that with Avicanna.
Powerful, man. Let's switch over to, let's move from Canada into the US. Yep. You announced this partnership with Red, White, and Bloom. I've seen this partnership, you know, distribution for the US, right?
Yeah.
And I've seen a lot of these over the past 18 months, couple of years. ABC Cannabis partnering with George Co. Cannabis, and, you know, they're going to make magic happen. Nothing comes of these things, right? Yeah. Sometimes I think it's almost like, let's just get a deal done, put it on paper, announce it because our stock price will go up. What's different about your deal is, okay, Red, White, and Bloom is a multi-state operator, right? But they're paying $250,000 upfront, and there's a $250,000 minimum order, correct?
Yep.
That speaks volumes to me, that this isn't just, all right, let's announce a press release with GeorgeCom distribution just so we can pretend we're showing investors something. This is real. If they're paying you $250,000 up front, what does that say about their confidence level and what they're going to be able to distribute for Avicanna in the US?
So I think you nailed it. I mean, I think I hope the audience starts noticing that we actually do what we say. You know, we're not promoters. We really do execute. And Pura, which is the line they have exclusivity to, is, in our opinion, and based on what we can find, the most advanced skincare line using CBD in the world. It's the only one that has clinical trials. We spend years developing it. And I have a very good relationship with the Red, White, and Bloom guys, especially the CEO, Brad. I've known him for many years within the sector, and he did a great job in CannTrust prior to, he wasn't there for the bad parts, you know, and Spectrum, which was Metrum. So he knows the quality and the research that has gone into these products, and he wanted to tackle it in the US, which I think is a great idea for us because we are more of an intellectual property company. Of course, I created Pura, and I think it's a tremendous brand and product line, but I don't have the bandwidth today to prioritize that into the US market. But Brad and those guys
cost you way too much. It would take way too much time. That would be almost impossible.
Yeah, and the opportunity cost of not commercializing it when it's the best product out there for skincare using CBD it would have been a shame. So this partnership is very beneficial to both of us because he has access to that market. He knows how to commercialize these type of products, and his team are there, and they have the infrastructure and they have the capital to do it. We have the formulations and the product, you know. So were they willing to put their money where their mouth was? Well, we certainly wouldn't have done a deal without some sort of licensing deal, because I don't think those guys would have done it for the press release anyways. But we are not doing deals for press releases. We're trying to pick partners, and we're doing very similar deals for Pura elsewhere in the world now, because my comment is, I've done my part. The product line is developed. It's leading. You want to sell it in your particular market, you want exclusivity, put your money where your mouth is.
And look, for everyone at home, remember the practicality of this too. If a company, look, if Agoracom had to do a licensing deal or partnership deal with somebody, I had to put up $250,000. I've got to presume, for me to put up $250,000 of my cash, that I'm going to be able to, I don't do $1 million to $1.5 million of profit for myself at least in a year. Otherwise, what's the point, right? I'm not going to pay Avicanna a $250,000 licensing fee to make $400,000 and net out at $150,000 or something like that. It's not the way it works. That's the practicality side. So if someone's putting up $250,000 and telling you another $250,000 in minimum, you probably can't give us a number, so I'm not going to ask, but Red, White, and Bloom, they're not fools, right? They know they're going to make a lot of money off this.
This is nationwide, right? This is over the counter CBD cosmetics. This is not a dispensary product. This is going to be e-commerce, big box retail. Think about the size in the US. We're talking about the best cosmetic skincare line with cannabinoids today available over the counter. You can walk into Walgreens and buy it at some point, right? And that's what this deal is about. It's about the potential of taking this to a real commercial industrial level.
Yeah, and how powerful is that for you guys at Avicanna to know that you now have exposure to the U.S. market, and you're not putting up the ridiculous amounts of money it costs to hire a direct sales team.
Exactly.
You're not putting up the ridiculous amount of money it takes to actually put marketing behind to create a brand, right? So this is all upside, and I'm really excited about this relationship. It's early. Can you tell us about where how this is progressing already? Are they moving fast? Are you able to give us? I know it's early, but anything you can tell us about that would be appreciated if you have it.
Well, we've been working on this for a long time. So I mean, we're done with the label designs and the printing. The manufacturing's already done. We're shipping the first samples out this week. We're doing the first pilot export out of Colombia. This is where these products are manufactured. Actually, it's U.S. CBD. But it's the final packaging and manufacturing is done in Colombia. We're going to be doing the first exported within the next 30, 40 days, like industrial one. And then we're already starting to roll it out. So we'll have revenue generated out of this in Q4. And it takes a longer time to get to the big box retailers, of course, but we're going to start with e-commerce. We're going to start with some smaller retailers, and we're going to start, kind of snowball affect the brand development, the launch. But we're already rolling through this. This is not a PR. This is the real transaction.
No, it is. And that's why I brought the down payment. That's why I brought the licensing fee. That told me, yeah, this is different. This isn't all right. Let's just hire on George Com in the US and hope and pray. And George doesn't really have a commitment to it, and he's and if it doesn't work quickly, it falls apart. This is serious stuff. Right. $250,000 cash. I don't care what business you are. You're not giving away $250,000 in cash unless you think you're going to get that back in multiples, right? Because of all the energy, time it takes. So I'm excited about that. I can't wait to see where that. To me, that's probably the most exciting part of this of what we're talking about today.
I'm very excited about the potential of that just because of the size of the market.
Yeah.
And we're talking about the U.S. And we last week exported to the U.S. CBG. So we started extracting and isolating the rare cannabinoids out of Colombia and exported that. So we're starting to get more and more exposure into the U.S. market, which is the biggest. So with cosmetics, with Pura, through Right and Bloom, we're working on a number of other deals in the U.S. already. We're now exporting raw materials. We're now exporting seeds into the U.S.
Yeah, this is the cultivation side for Urban at Home. This is the great part about how we're talking vertically integrated. We start off with medical cannabis, then we talked about the cosmetics, derma side, and now we're in the cultivation side where you're talking about seed being exported into the U.S. and Germany.
CBG and raw materials. So not just seed, but we're talking about purified CBD.
Right. And let's talk about CBG for everyone at home. Just give everyone a quick 30-second reminder. We all know CBD isolates, but CBG, just a little 30-second.
Yeah, of course. So we were the first, we made the first ever, again, from our understanding, historic export out of Colombia last week of purified CBG into the United States. CBG is another non-psychoactive cannabinoid, such as CBD. However, it's actually got higher affinity to some of the endocannabinoid receptors, which means it's more effective than CBD. But historically, it was a very rare cannabinoid, which means you wouldn't find much of it in a plant. CBD, you can have 10, 20% in the flowers. THC, more than 20 in the flower.
Sure.
CBG was always 0.1, 0.2. We have developed a genetic through DNA-led breeding that gives us about 17% CBG. So we're cultivating that commercially, we're extracting that commercially, we're isolating that and crystallizing that commercially, and we are now exporting that. And last week we exported to 3 different clients in the United States, an industrial export of CBG. We had purified CBG, which was a super rare cannabinoid and now it's being commercially exported. So on the raw material side, we're not competing at a commodity level with CBD anymore. We're only working on THC, CBG, CBC, and seeds. So we're doing the high margin, ultra proprietary, less competitive areas. So that's what we accomplished.
Yeah, you're not in the commodity space.
No, I mean, everything we do is science-based, right? So even on the cultivation side, we took a pretty strategic approach to looking at the high margin, less competitive, more proprietary products. And that's what that export was.
Is the export into the U.S., is that business going as expected, slower, better? How is that side coming along in terms of progress and
It's
pace?
just starting. It's just starting, but I mean, I think people underestimate how difficult it is to navigate through the regulations of cannabinoids at a global level. So these exports, like we made the CBG export. Everyone was like, well, what was the value of that? $30,000, $40,000. That doesn't move the needle. But my point is, I officially exported cannabis derivatives from Colombia with the federal government approval into the United States of America. And as a TSX company, had to show every part of that transaction. And I used tracking and tracing systems with TrueTrace. Who the hell has done that? You know, and think about the value of that as a concept, as a milestone, not just share on the revenue, because now I can do larger orders. That was the first one, right? That was a pilot. So
being able to get through the door is the $1 million value there. It's not the dollar amount, just the fact that you're able to, the federal government is allowing Avicanna, right, to export from Colombia into the US. That's
so two federal governments.
How hard is that to do?
Yeah. Two federal governments and the Toronto Stock Exchange had to basically approve this process.
You also sold some CBD isolate into Germany.
Yeah, that was a very small amount. It was a pilot, but it was the TSX basically makes us press release every single export we make to any country, at least the first time. So even if I ship 10 grams to Canada, well, which we did.
I didn't realize that. Yeah. Why is that considered material under the TSX, where they say, hey, everybody should know if you're shipping?
It's a way of validating that what we're doing is federally legal from all the jurisdictions we operate in. So you're basically screaming out loud, I exported cannabis products from Colombia to this country, and I'm sure that what I did was legal, and here's the proof. I press released it.
Well, congratulations. And Ras, this interview once again should prove to everybody at home that Avicanna is truly vertically integrated. I know so many companies try and make that claim loosely, but we just talked about going reverse the cultivation side, right? 500,000 square feet of cultivation space in Colombia, where you're USDA certified organic, right? At the same time, so that's happening. We now know that your cosmetics product has a serious partner, and you have the medical cannabis side with the best partner you could possibly have in Canada nationwide, Shoppers Drug Mart. They're online, obviously the online cannabis. So congratulations to what you guys are doing. There's no doubt about, to me, where it's the only question now for Avicanna is not a question of if anymore. That's off the table. Now it's just a question of how big. And for people who are watching this at home, don't treat Avicanna press release to press release. Start looking 6 months, 12 months, and 24 months out, because those are the milestones. They're already in Shoppers. Let's see how that does in 6 months. Yeah. You know, they're in the US. Let's see how that goes in 12 months. You got to give that a little more time, right? Absolutely. And you got the whole program 24, but 6, 12, 24, man.
And I would add one.
It was good, Aras.
No, and I appreciate that, George. And I think that's why we're excited, because we are now at a position, at a time where we have de-risked the company. As a biotech, biopharma company, the moment you commercialize in various markets, it's completely de-risked, because your R&D's worked, your preclinical has worked, your tech transfer and manufacturing has worked, you found your supply chain, you found your manufacturing partner, you found your distribution partner, you built your brand, you have a recognition. We've done all of that. We're now at the stage where we start reaping some of those benefits. And because of the conditions of the market, the pressure has made the company become a lot more self-sufficient, self-reliant. And we've turned Avicanna into a biotech, biopharma company that is diverse in revenue and sustainable, which you don't have in the biopharma world ever. You know, so we've taken a very, very strange but unique approach that I think will make us sustainable throughout the shakeout of this industry.
Yeah. And I got to tell you, the amount of work you put in, because I really have an understanding of it as an objective third party, because, people at home can say, well, what else is Aras going to say? Man, to get all these pieces together over the last 3 years, and to do it while you're watching, let's face it, a bunch of run and gun, George Co. Cannabis, who with $500 million market caps, really doing nothing but investing a ton of money in stock promotion,
Right.
had to be frustrating. And yet you guys stayed the course. You said, we're going to do this our way. We know where this industry is going to be in the next 10, 15 years. So if we got to wait 2-3 years to do it right, but you guys are there, and you should be very proud of what you guys. I'm proud to be part of the team representing you guys. I really mean this, because I can talk to anybody watching me talk, anybody I speak to about Avicanna just sees in my eyes, right? It's not a story. It's
We really appreciate that.
Love it. Congratulations. And maybe you and your team can get some well-earned rest this Labor Day long weekend, Aras, because it's going to be crazy for you after this, right into the end of the year.
Absolutely. No, thanks a lot, George. Really appreciate it, and happy to be on these calls.
Yeah, love it, and keep it up. Yeah, all of us are cheering for you guys and can't wait to see what's next. You've been watching, or if you've been tuning in by podcast, listen to Aras Azadian. He's CEO of Avicanna, trades on the big board TSX under the stock symbol AVCN, and for our friends in the US, on the big board over-the-counter market, that's the OTCQX under AVCNF, and even in Frankfurt under ONN for our friends in Europe. You've heard what Aras had to say. Your job now, trust me, guys, do your due diligence. Cannabis has gone through some tribulations over the last 15 months. We've seen that before. Remember the .com days, that crazy valuations, people running over each other, and then that crash because reality didn't fit, what the actual valuations were up to. But the next wave is going to come, and this is going to last an eternity, because the market is no longer rewarding George Co. Cannabis. Those guys are out. They're not getting any attention, financing, nothing. The market is going to pay attention to the real companies, and this is going to be a 10, 20-year run for the cannabis industry. There's no doubt about what medical is going to do. There's no doubt about what the pharma side is going to do. It's going to penetrate our lives. Avicanna, don't look back and say I could have had Avicanna in 2020 and didn't take it seriously. Do your due diligence. Appreciate you all tuning in, and have a great, safe Labor Day long weekend. Talk to you next time.